Hello ladies, my name is Dr. Salwa Faraj, an obstetrician and gynecologist found on Truemed online. Today I'd like to discuss with you uterine fibroids. 50 to 60% of women are actually having fibroids walking around undiagnosed. That doesn't mean that all fibroids need treatment. What are fibroids? So fibroids are basically some benign, which means non-malignant growths within the uterus. So depending on where they're growing, the size of the fibroids, the symptoms that they're giving you, that's when you would actually say that you would need medical attention because of a fibroid. So there are different types of fibroids based on where they grow. We have subserosal fibroids, which are fibroids that grow on the outside. Usually that presents with a lot of pelvic pain, as well as pressure-like symptoms like constipation, or you're not able to go and pass urine very comfortably. That's because the fibroid is found outside, it would give a pressing effect on all the other organs around. The second type of fibroid is called an intramural fibroid, which is just a fancy name to say the fibroid is within the muscles of the uterus. When it is found within the inside the muscle of the fibroid of the uterus, in that situation, it would mean it would distort the endometrial lining. The endometrial lining is the lining of your uterus that sheds off during your period. So that would mean you would either have a little bit more painful periods or quite heavy periods. If those symptoms are there, then you would definitely have to seek attention with a doctor. The third type of fibroid is called a submucosal fibroid. Now, a submucosal fibroid is a fibroid that's found on the inside lining of the endometrium, which again is the lining of the uterus. So when you have a fibroid on the inside of the uterus, it just means there is more tissue for you to bleed out of. That is, there is more pain. So you would actually have painful periods, you would have periods that are really long and very heavy. It can also affect you getting a baby as well as maintaining a pregnancy because it is on the inside of your uterine lining. If you have any of these symptoms and signs, then I would actually encourage you to see your healthcare professional, or please contact us on Truemed online. Thank you.